Bismillahirrahmanirrahim. Assalamu alaikum. My name is Ikra Mariam and my roll number is BP1650092. The drug which I am going to discuss is chlorpromazine. Chlorpromazine is an antipsychotic medication primarily used to treat psychotic disorders. Chlorpromazine belongs to first generation antipsychotic drug and is also known as conventional, typical or traditional antipsychotics. Rational use. Rational use of chlorpromazine is in psychotic disorders, schizophrenia, anxiety, nausea, vomiting, behavioral problems in children, and is also used in resistant or intractable hiccups. Hiccups, if last more than a month, they are known as intractable hiccups. Side effects. Side effects of chlorpromazine are extrapyramidal symptoms that are movement disorders such as Parkinsonism, tremor, tardive dyskinesia, that is irregular jerk movement, dystonia, that is continuous muscle spasm, and akathisia, that is motor restlessness. CNS-related side effects of chlorpromazine are headache and seizure. Its cardiovascular side effects include hypertension, orthostatic hypertension, and tachycardia. Its metabolic side effects are anorexia, constipation, and weight gain. Mechanism of action. Chlorpromazine is a competitive inhibitor at a variety of receptors such as cholinergic receptors, alpha-adrenergic receptors, dopamine receptors, and histamine H1 receptors. But its antipsychotic effects are due to competitive blocking of dopamine D2 receptor, which is also associated with extrapyramidal symptoms. Counterindication. Chlorpromazine is counterindicated in liver damage, coronary disease, bone marrow depression, severe hypertension, and hypotension. It is also counterindicated in barbiturates and alcohol withdrawals. Drug-drug interaction. Quinolones such as amodaclyn and chloroquine, when taken with chlorpromazine, they cause increased serum concentration of chlorpromazine. Anticholinergics are given with chlorpromazine will inhibit neuroleptic response that will result in excess cholinergic effect. Narcotic analgesic when taken with chlorpromazine, they cause hypotension and increase CNS depression. Irrational use. Irrational use is patient receive medication that is not appropriate for their clinical needs. Irrational use of chlorpromazine is patient with dementia-related psychosis when treated with antipsychotic drugs are at high risk of death. Available dosage form. Chlorpromazine is available in different dosage forms such as tablets, syrups, and injections. Also, different strengths of tablets are available that are 10 mg, 25 mg, 50 mg, and 100 mg. Brands available. With the brand name of Largactil, it comes as tablets, syrup, and injection by Sanofi Limited. Its tablets are also available with brand name of Chlorotil and Chlorpromazine by Unexo Limited and Star Laboratories. Dose. It has different dose according to the age of patient and condition. For psychosis, its adult dose is 30 to 75 mg per day per oral to 6 to 12 hourly, that is loading dose, and then maintain on 100 mg per day in divided doses. For hiccups, its dose is 25 mg QID and it can be increased up to 50 mg if needed. In children, it cannot be prescribed in children of less than 6 months of age. For children above 6 months, its dose for behavioral disorders and hyperactivity is 50 to 100 mg per day per oral. For elderly patients, the adult dose can be reduced to third half to 1/2 or 1/2 if required. Toxicity. Symptoms of chlorpromazine toxicity are loss of consciousness, drowsiness, hypotension, tachycardia. Severe symptoms include convulsions and coma and severe extrapyramidal dyskinesia. Antidote. There is no specific antidote for chlorpromazine toxicity. Treatment is supportive and treatment should be symptomatic with continuous respiratory and cardiac monitoring until the patient condition resolves. If the patient is seen soon after ingestion of toxic dose, gastric lavage, that is cleaning out the content of the stomach, may be affected. Now case study. A 60 years old man was admitted with hiccups lasting for 3 days. He had no fever, cough, sore throat, chest tightness or shortness of breath. His neurological examination and magnetic resonance images of the head were normal. He was then referred to the internal medicine department for the differential diagnosis of hiccups. He also had no previous history of chronic disease such as gastrointestinal, neurological or anxiety disorder or benzodiazepine or opioid use. Also, he reported no alcohol intake and was not a smoker. His blood pressure was 120 by 70 mm of Hg. His respiratory rate was 24 breaths per minute. His heart rate was 96 beats per minute. His temperature was 36.7 degrees centigrade and his atrial oxygen saturation was 98% on room air. Ent and abdominal examination were also normal. His electrocardiogram was also normal. His routine blood test was done, which indicate white blood cells, neutrophil counts, lymphocytes counts, total number of lymphocytes, potassium, sodium, urea, C-reactive protein, serum creatinine, lactate, dehydrogenase, aspartate aminotransferase levels were all normal. Blood tests for rapid detection of influenza A, influenza B, and respiratory syncytial virus were also negative. But his blood test shows positive D-dimer, increased alanine aminotransferase and ferritin levels, and low troponin levels. Escalation of the lung shows moist crackle. After that, the patient's chest X-ray was acquired. Chest computed topography was performed in which small ground glass nodules were seen scattered across the two lungs, suggesting viral pneumonia. Reverse transcription, polymerase chain reaction, analysis of the patient throat swab sample were positive. Patients were then hospitalized after diagnosed positive for COVID-19 and moderate pneumonia according to the WHO classification. During hospitalization, favipiravir 1600 mg once daily, that is the loading dose for 1 to 2 days. Afterwards, 600 mg twice daily for day 2 to 5. Antiviral treatment was added to treatment and dexamethasone and azithromycin 1500 mg once daily as a loading dose, and then 2 to 5 days 250 mg once daily maintenance dose were given. Therapy were used as recommended in the COVID-19 guidelines. The patient hiccups did not improve for 2 days after treatment initiation and he had insomnia. What medication should be given to patient to treat his hiccups? Now, soap notes. Subjective. Patient was 60 years of age, male, with his chief complaint was hiccups lasting for 3 days. Medical history. The patient had no previous history of chronic disease such as gastrointestinal, neurological or anxiety disorders or benzodiazepine or opioid use. He reported no alcohol intake and he was not a smoker. Current medication. He is not taking any medication currently. Objective. Laboratory data. Escalation of the lungs shows moist crackle. Chest computed topography was performed in which small ground glass nodules were seen scattered across the two lungs, suggesting viral pneumonia. Reverse transcription, polymerase chain reaction, that is RT-PCR analysis of the patient throat swab sample were positive. Blood test shows positive D-dimer, increased alanine aminotransferase level, increased ferritin levels, and low troponin levels. Vital signs. Blood pressure was 120 by 70 mm of Hg. Temperature was 36.7 degrees centigrade. His respiratory rate was 24 breaths per minute and heart rate was 96 beats per minute. Atrial oxygen saturation of the patient was 98% on room air and his heart rate, Ent and abdominal examination were normal. Assessment. Escalation of the lung of the patient shows moist crackle. Escalation of the lungs is the lung sound heard with stethoscope. Moist crackle is abnormal lung sound, indication of inflammation or edema of air sacs in the lungs, after which his Chest computed topography has done, which shows small ground glass nodules scattered across the two lungs, indicate viral pneumonia. His PCR analysis tests are positive and blood test shows positive D-dimer, increased alanine aminotransferase level, increased ferritin level, and low troponin level. These were all the indicative of positive COVID-19 and moderate pneumonia according to the WHO classification. He is immediately hospitalized and treated for COVID-19 with favipiravir, an antiviral, offloading dose 1600 milligram for day 1 and 2, then maintain for day 2 to 5 on 600 milligram twice daily dose. Dexamethasone and azithromycin 1500 milligram once daily for day 1, then maintain on 250 milligram once daily for day 2 to 5. Therapy was used as recommended in the COVID-19 guidelines. But his hiccups did not improve for 2 days after treatment and he had insomnia. Plant. Chlorpromazine for his resistant hiccups and insomnia can be an effective treatment given in the dose of 25 milligram QID for 3 days and can be increased up to 50 milligram 4 times a day if needed. As chlorpromazine taken bedtime helps insomnia therapy as it has sedative effect, and it can be a choice of drug for resistant hiccups. After 10 days of treatment for COVID, his PCR and chest CT scan should be done, and follow up for 2 months after discharge should be done. These are the sources from which the information is taken for this presentation. Thank you.